Hi everyone, thanks for tuning in to the Delta Student Nurse Talk Show, where every week we discuss healthcare topics to further educate our community. On this week's topic, we have ischemic stroke. I'm Yessie.
I'm Izzy.
I'm Kay.
And I'm Jessie.
We hope that by the end of today's video, you can recognize the symptoms, understand the causes, and what you can do to help other adults in your community. Now, I will transition over to Izzy.
So, ischemic stroke is the most common type of stroke. This can occur when blood vessels that supply blood to the brain become blocked, causing a blood clot or buildup of fatty deposits known as plaque. When this blockage occurs, it can stop oxygen and nutrients from reaching parts of the brain, damaging brain cells. You may be asking about hemorrhagic stroke. Well, hemorrhagic stroke is when blood vessels rupture, causing bleeding in the brain. So that's the difference between the two. Causes and risk factors, you have things that you can control. High blood pressure can be controlled. Diabetes can be controlled. Smoking is a big risk factor. You may be wondering, how does that pertain to stroke? Since it damages the lungs more so, but it can damage the blood vessels, which increases clotting risks. Obesity is another risk factor, physical inactivity, and alcohol and drug abuse. Things you may not have control over would be your age, your family history, race and ethnicity. African American, Hispanics, and Asians are at a higher risk. Women also are at a higher risk. And then if you've had a previous stroke, your chances are greatly increased. So signs and symptoms to recognize a stroke, we use this acronym called FAST. F stands for face drooping, A is arm weakness, S is speech difficulty, so slurred speech, and then T is time to call 911. Additional signs and symptoms you could see would be numbness, confusion, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance, and severe headache. Early action is critical for ischemic stroke. Every minute the brain is deprived of oxygen, millions of brain cells die. By acting fast, brain damage can be limited by restoring blood flow, which can improve recovery and reduce risk of complications that can be life-threatening. When 3 signs are noticed, 911 should be called immediately. Now we will transition to a quick role-play scenario of how to identify fast.
I know this has been a scary day for you. I want to take a moment and explain the signs we look for when we suspect a stroke, so you know what to look for moving forward.
Yes, please. I had no idea that this could happen so quickly.
It really can. That's why I use the acronym FAST. It helps people remember the warning signs. F is for facial drooping. You might notice one side of the face doesn't move the same. A is for arm weakness. They might not be able to lift one arm fully. S is for speech difficulty. Words can come out slurred or hard to understand. And T means it's time to call 911 immediately. The sooner we treat the stroke, the better the chance of reducing the long-term damage.
He was starting to slur his words earlier, but we all just thought he was tired.
That's a common reaction. But in cases like these, we always say, when in doubt, call it out. Calling 911 quickly can make the difference. I also have this hand pamphlet for you that you can take home to read more about.
Thank you so much.
No problem.
Wow, what a great scenario, and a great way for you guys to understand how to identify fast. Now I will be going through some diagnostic tests in order to catch ischemic stroke. We typically use CT scan, which uses computer technology in order to produce images of the inside of the body, or an MRI, which uses non-invasive imaging, magnetic waves and radio waves in order to produce an image, and lab work. Once diagnosed with a stroke, some interventions include administering TPA, which is a clot-busting drug that breaks down blood clots, restoring blood flow to the brain, blood pressure management, because high blood pressure can increase your risk of a stroke, supportive therapy, including oxygen and IV fluids, antiplatelet therapy, which would be giving aspirin. Aspirin works to prevent platelets from clumping together and forming blood clots, which can also lead to a stroke, and lifestyle changes. Nursing management of a stroke can consist of frequent neuro checks, which overall assesses the function of the nervous system in order to evaluate your neurological injuries if there are any, monitoring vital signs, and implementing fall precautions. due to stroke causing muscle weakness and balance issues. Education would be fast, medication adherence, and decreasing your risk of stroke through smoking cessation, increasing your physical activity, and blood pressure management. Now, we're going to transition to some resources you might use.
All right, so 2 community resources that patients and families can use to manage ischemic stroke can be number 1, St. Joseph's Medical Center Stroke Program, which is located in Stockton, California. This local resource offers stroke care, aka making rapid diagnoses and administration of treatments to minimize any brain damage. They also offer rehabilitation such as physical, occupational therapy, and speech therapy to help with recovery, and education on stroke prevention and recovery. The phone number is 209-939-4576, also located at the top of your screen if you are interested and want more information. And number 2 will be San Joaquin County's Public Health Services. They offer blood pressure screening, which is important to detect and manage hypertension, which we know is a leading risk for stroke. They also offer wellness programs like how to have a balanced diet, how to engage into physical therapy, and how to reduce risk of stroke and other diseases. If you want more information, go ahead and go to sjcphs.org. Now that we know the local resources in the San Joaquin County, we're going to talk about how we can implement all the information we've discussed about ischemic stroke and apply it to the clinical setting.
Nurses play a crucial life-saving role in the care of ischemic stroke patients. They are often the first person to recognize stroke symptoms, initiate rapid response protocols, and perform vital neuroassessments. Nurses ensure timely diagnostics and treatments are administered, and you're closely monitored for any complications that may come, like bleeding or brain swelling. They even provide essential patient and family education on stroke prevention, recovery, and lifestyle changes. Nurses also help families navigate the overwhelming emotions and decisions surrounding a stroke, offering emotional support, resources, and clear communication about what to expect.
Now for our recap. We hope you learned more about ischemic stroke, what causes it, how it can be prevented, treatment, and resources in our community. Thank you for tuning into this week's Delta Student Nurse Talk Show. Please leave a comment and share this video to the friends, and we'll see you all next week. Thank you.
Thank you.